Welcome back, everybody. Hey, our next guest is a representative of Visiting Nurse Service of New York, and she's going to be speaking with us about how her organization is working to provide care for vulnerable individuals and families during COVID-19. Please welcome to the show, Michelle Drayton, VNSNY, Hospice Access and Hope Program Director in Manhattan and the Bronx. Michelle, welcome to the show.
Thanks, Bob. It's great to be here. Great to see you, and delighted about working with you on our upcoming Physicians and Health Leaders Summit for September 15th.
Yeah, well, it's going to be fantastic, I hear, and looking forward to it. We'll speak more on it later on tonight, so we'll do a run through and everything. But give us the gist of what's going on, I mean, with your organization and the work that you do, because you've been doing a lot in the community for some time now.
Yeah, well, the impetus for the summit is really born out of the HOPE program. You and I have spoken about this previously, which is it's actually a hospice outreach program dedicated to focusing on African Americans and Latinos, really trying to address the underutilization of hospice, and really also to address the disparities that many communities of color face when they're accessing care. I think, during this whole COVID-19 pandemic, we learned a lot about our healthcare system and what some of the gaps are, and how to address them. This particular summit is bringing together, high-level physicians and healthcare leaders to talk about some of the problems and some of the deficiencies within the healthcare system that impact people's ability to access care.
What are some of the problems and the deficiencies that you can speak of today?
Well, we're going to be looking at some of the access issues. So, for instance, do you have a primary care provider? If you were, had symptoms of COVID, did you have someone to actually call and to discuss whether or not you should get tested? Did you have access to testing? If you needed to get a test, did you know that there was free testing available? Also there are issues, as you know, in our community, particularly as it relates to vulnerable populations. We have issues related to insurance coverage, people who are either uninsured or underinsured. They may not have a primary care provider at all. On the hospital side, there was issues related to personal protective gear. If you ended up needing to come into a hospital setting, oftentimes you were not able to bring a family member or an advocate with you. And so that has significantly impacted both the experience that patients have, and then of course the impact on their family. So this summit is very important, not only as a sort of examination of what we're doing in time, but to look at what we need to be doing going forward, how we as healthcare providers, policymakers, and community leaders and consumers need to be working together to improve the system so that we don't have the sort of disproportionate rates of COVID-19, not only the disease in our community, but also the high rates of mortality, people dying at higher rates than other populations because of access. Yeah,
but there's a couple of reasons for that. I mean, there's the degenerative diseases that people have been talking about, whether it be diabetes or asthma and all those high blood pressure. It seems to have attacked those areas.
That's COVID-19. That's a good point, Bob. I mean, clearly, if you have predisposing health problems, like you mentioned, COVID-19 is a virus. It's primarily a respiratory virus. So that if you have predisposing health problems, like asthma, like cardiac disease, you may very well end up with a more severe case of COVID-19. But let's even talk about getting the disease, you know, just in general, whether you have pre-existing conditions or not. I think, you know, the issue is, apart from that, why are there such high rates of COVID-19 within our communities? What's happening within our communities that's making us more at risk even just to get infected? And so, you know, the physicians on the panel, as well as other, you know, health leaders will speak to that issue as well. Whether it's, you know, a crowded home situation, whether we're more likely to be in jobs that are putting us at risk of exposure. We have so many people who have gotten this disease or who have died from the disease, who are our frontline healthcare workers. They're our certified nursing assistants. You know, they're our home health aides. They're, you know, they're the nurses that are out every day doing the work and are, you know, as a result of it, more at risk.
I tell you, our frontline people risking their lives and sometimes losing their lives to go on helping us living our lives. We gotta continue to applaud you guys. You mentioned a little while ago about the underutilization of the hospice program. Talk about that.
Right. So, you know, the Visiting Nurse Service of New York, we're a 127-year-old organization. We are the largest home health care organization in the country. We've had a hospice program for 37 years. And as you well know, I know you've had personal experiences with your mom as well as myself, that, you know, end of life care is so critical. And there is a point, you know, that we will all be at where, you know, there's nothing more medically that a physician or healthcare provider can do for us. And there is the opportunity for people to access hospice, which is care at home. It is comfort care, it is pain management. There is a coordinated and interdisciplinary team of healthcare providers, social worker, nurse, physician, spiritual care counselors that could actually provide you with comfort care in the home. Unfortunately, this incredible program goes underutilized by African Americans and Latinos, and also Asians and Native Americans. I think, you know, this speaks to disparities. Why is there a gap in utilization, whether we're accessing primary care or we're accessing specialty care or we're accessing end-of-life care? We know for our community, you know, when you look at, you know, racism and other things like social determinants of health, where we live, work, and play, has a major impact on how we use services and how we live our lives. And so this program, the HOPE program, really sort of, you know, puts a spotlight on how can we increase access. And so we're going and working with the community. We're working with faith-based leaders. We're working with institutions like Harlem Hospital, like Mount Sinai, to make sure that there is adequate staffing in place to help people access care.
Yes, yes. And that's one of the things that people are afraid to talk about. They don't want to talk about end of life situations where, hey, where are they going to bury me? Or where are they going to, all of those things pertaining to that. It's like,
exactly.
I don't want to talk about that. But
it's a little bit of a taboo issue.
Yeah, but it's going to have to come up. You're going to have to talk about it because, you know, one thing that the pandemic did was make you realize that there's a whole lot of things that you need to put in place, that, you know, things can happen just like that. And you need to have those things in order.
Absolutely. I just wanted to just make that point that you just said, the whole issue of advanced care planning. You know, even for people, let's take, you know, this pandemic where you do end up, you go to the hospital, you're feeling short of breath, you're having palpitations, and you end up being diagnosed with COVID-19. you're in a hospital situation, but you have no advanced care plan, no documentation that says, if I'm unable to speak for myself, this is what I want and this is what I don't want.
And sometimes you don't have time to think about that or prepare because things are happening so fast.
Absolutely.
So you gotta have those things in order. They're going to wrap me right now, but where can we go to get more information on what we're doing?
Okay, so yes, absolutely. So for the summit, for the physicians and health leader summit, everyone who is concerned about health and well-being should attend. They go to basically www.vnsny.org/Project Hope Summit. And they could also contact me. They could Michelle.Drayton at VNSNY.org. And hopefully you'll have that information posted.
And I believe this is going to be covered by BronxNet.
That's correct. So this is great. And so we invite people to actually be a part of this Zoom meeting. It's from 9 a.m. to 10:15 on September 15th. And they'll have an opportunity to chat with not only you, but healthcare providers and other people who are really responsible for making decisions about the system and how we provide care.
Michelle Drayton, VNSNY, Hospice Access and Hope Program Director of Manhattan and the Bronx. Thank you. Thank you for being with us. And thank you for tuning in and checking it all out. If you want to continue with us, you can go to BronxNet.org and all the information will be right there and you can continue to view us too. That about does it for me, the Dr. Bob Lee. I'll catch you on the radio on 107.5 WBLS. Always remember this, what you are is God's gift to you and what you make of yourself is your gift to God. So choose a choice and let the choice control the chooser. And remember, whether they say you can or you can't, either way, you're right. Thank you for letting us share in this space and time with you. I'll catch you another day, another way. I love you all. Peace.